Drug overdose is the leading cause of accidental death in the United States, but with chronic pain, sometimes it seems like there are very few options for medical treatment. Our next guest says there is another way to help pain without the use of opiates. Please welcome Dr. Nomen Azeem. He is here to tell us how to find relief without getting addicted. That's something that scares me to death with surgery, doctor.
No, I completely understand. Thank you very much for having me. I think this is a wonderful opportunity to get the word out. As an interventional pain physician, I see patients in chronic pain every single day, and the debilitating effects physically, emotionally, socially are debilitating.
Yeah.
I mean, they really do take people's lives away. So, it's one of these things where, well, as a society, we've gotten used to taking the easy way out, and a lot of times that's with opioids, okay? So opioids are just pain medications, okay, that are derived from opium, okay? And opium is very long-standingly known as a powerful pain reliever, but also is very addictive.
Yes.
Yeah.
So what can you do if you've got terrible pain, but you don't want to get addicted to that?
Well, so we brought some models today.
You brought some friends,
We
parts
did.
of old friends.
That's correct, yeah. So there are a lot of interventional procedures now. A lot of research and development have gone into new technologies that can block pain without the use of opioid medications, and without the use of chemicals.
So we say block it, like you numb that area so you don't ever feel pain there?
Kind of, sort of. So what it is actually, we're blocking the pain that's being transmitted by nerves. Okay, so it's not necessarily numbing the area, it's more so actually using different modalities to block the pain at the level of sometimes the spinal cord and sometimes nerves peripherally.
What are these things? How do they work?
So this is an interesting device. So we're going to touch on,
So it's a needle?
It's a needle, right.
It's a large needle.
So what this is for patients that have neck pain, mid-back pain, and low back pain due to arthritis in the joints, and we're talking about these types of joints right here called facet joints. This is a device that can actually target the nerve that transmits a pain signal from those joints.
So let's say, I don't know what a nerve is, so let's say this is nerve, you just stab it?
Oh, no, you don't want to stab it. That is something you do not want to do.
Don't give both that thing.
Hence, I'm not a doctor.
That is a bad outcome.
Okay. No worries.
No. So what happens is each of these joints have a branch from these big nerves that actually travels along the bone and then goes to the joint. Okay. So what we do is we can actually place a probe that along the joint, okay, and we can actually, the technology is where you use an electrical impulse and a radio wave that heats up the tip of this probe, okay, and it actually heats up the nerve that it's overlying, and that helps to block the pain signal.
Wow.
Okay?
And how long does that last?
That's a great question. So anywhere from 6 to 24 months.
Oh,
Wow.
so you only have to have it done once, say you've had surgery or something.
Well, this can be done before surgery or after surgery. Yes, my intention is always to do one procedure and get the longest term relief. Now, with something like this where you're targeting arthritis in the neck or the back, now the patient has pain-free, period of 1+ years where they can engage in things like physical therapy, okay, strengthen their core musculature, whether it's their neck or their low back, and really physically and structurally change the spine so that when the nerves do regrow, which they do, which is why the pain comes back, then structure their spine is so much better.
Oh my, that sounds like a miracle.
Yeah.
Because with pain, you can't live your life. You
Correct.
just can't go on with that
That's
kind
correct.
of pain.
That's absolutely right. The numbers are staggering in terms of chronic pain and how it's affecting our society.
Yeah.
And you could do a lot of different parts with this?
You can actually.
I'll take this home,
So you
thank
can do the neck, the mid-back, the low back, the knee, the hip, the foot and ankle.
All
so
the
a lot of
key
indications.
places that people have these pains.
Oh, thank
That's
you,
right.
doctor.
Yeah.
We're looking at a miracle. Thank you so much. And to learn more about it, you can go to soa.md to get more information, because you certainly don't want to suffer when you don't have to.
That's correct.
Thank you so much.